Hello, everybody, and thanks so much for joining us today for part two of our Health Talk series with Dr. Dominik Nowak. I'm Lisa Machado. I'm the executive producer of healthing.ca. Today, we're talking about the importance of caregivers, and it's one of my favorite and most dear to my heart topic. So, just to introduce you to our panelists today, you all know if you joined us for our first webinar, Dr. Dominik Nowak, family physician, health leader, advocate for patients and caregivers. We have Maggie Keresteci, executive director at the Canadian Association for Health Services and Policy Research, and Terrence a caregiver to his younger brother who lives with Duchenne muscular dystrophy. He's also the head of partner success at Braze Mobility, which is a very cool company that has manufactured blind spot sensors for wheelchairs. What an amazing story. I'm so happy to have this panel today, and I'm looking forward to a very inspiring and exciting and interesting discussion about how we can increase the engagement of caregivers in our healthcare system. So thanks all of you for being here. Just a couple of things for our viewers before we get started. If your video quality is poor, just click here to refresh stream. You'll see that on your screen. If you're having any technical issues, click on the help button and someone will be in touch with you to help walk you through. To ask a question, just click on the questions tab at the far right of your screen. A new window will open. You can type your question and I will receive them and add them to the discussion. So let's get started. We all know that caregivers are extremely valuable. I mean, at least us on this panel. Now, for some reason, though, our healthcare system does not. So I want to kick it off with Terrence first, and then Maggie, to talk about a little bit about your experience as a caregiver, and why don't we engage caregivers, and why doesn't our system recognize the value of caregivers? Terrence, start with you.
Sure, thanks, and thanks for having me. So I was thrusted into the role as a caregiver when I was probably around 10 years old, when my brother was diagnosed with Duchenne muscular dystrophy. But back then, I didn't identify as a caregiver myself because no one called it that, or no one in my family called it that. So really the role that I played was just as a brother and as a son to really support our mom caring for my brother. So for years, as a sibling caregiver, I had no support in any way because I wasn't given this like identity as the caregiver or the sibling caregiver. So really it wasn't until maybe even like 5-6 years ago that I recognized that, oh, I am a caregiver or I am a sibling caregiver, and that there are caregiver resources out there to also support me as a caregiver. That's when I realized that, who I am to my brother and who I am to my family. Because even when I went to see my doctor or went to organizations like, for example, like Bloorview, like no one really talked to me that, what you're experiencing right now is of someone as a caregiver. So I feel like in the healthcare system, that is definitely a gap that I experienced growing up. That because no one talked to me about the role that I'm playing, even though it may be informal, that whatever emotions and all that I'm experiencing is related to being a caregiver.
Mm-hmm. Yeah, fair enough. And I think, and it's hard as a caregiver too, to have those conversations, isn't it? When you're knee deep in these responsibilities and trying to manage your own health and your own life. It's a difficult conversation to have. Maggie, what do you think?
So, I think a lot about why I got involved in this and why I'm part of this. And so I first want to thank you for inviting me today. But, ours is a story of what happens in a fragmented system, of what happens when we lose sight of what I'll call our North Star, the person. When we talk about having a person-centered system, what we really mean is we have a system that is person-centered when it's convenient. So I care for my 88-year-old mother who lives with me, and for my sister, who I cared for in her initial journey during her breast cancer treatment. surgery, chemo, radiation. And then just when we thought that was over and we were shifting into what we thought would be recovery mode, she developed some new alarming symptoms. And as it turned out, after a year, so it took a year to diagnose, and we found out that she has a rare insidious cancer that meant that she had this 20+ hour surgery, weeks and weeks in the ICU, and what became a life-changing reality. And like Terrence, thrust me into this role of not just sister, but caregiver. During the year between when we started to report her symptoms and when she got diagnosed, she was bounced around, Lisa, from provider to provider, from lab to lab, hospital to hospital, with 4 different hospitals having parts of her care. And for me, the epiphany as a caregiver was that I was the only one who knew the whole story. I was the only one who could connect all the dots. None of this army of providers were connecting the dots. And each of them had pieces of the puzzle, but no one had the whole story except for me. Her caregiver, who was not seen as part of her care team. And that's a problem. And I, to this day, carry considerable guilt that I didn't pull all the clues together about her, what should have been her ultimate diagnosis. And again, it's despite this constellation of care, there was no circle of care. I'll just end by saying, my entire career has been in healthcare. And I've worked in clinical settings and analytics and health policy. But in fact, I have learned far more about healthcare and what matters in healthcare in the time that I've been a caregiver than I did from any textbook, any work experience, any education.
Thank you. I think, before I go to Dominik for his opinion from what he sees as a doctor, I want to, just address your comment about guilt. I think that this is one of the things that it's the cost of not engaging caregivers as well. So there's a long list. The laundry list of the impact of not including caregivers in a care team is massive. The impact on the patient, and all of that impact on outcomes. But also, it's important to reflect on what caregivers lose as well. It takes something away from us. And it's something, that you can live with for years after, right? You're, questioning yourself and if there was something that you could have done, and which is unfair, unfair. And I think it really highlights the impact of excluding caregivers, and something that we don't actually talk about a whole lot. Dominik, I'm going to turn it over to you. What are you seeing? What's your perspective?
Yeah, you know what? I'm a family doctor in my day-to-day work, and I think what I'd add to this conversation is that these stories are they're everywhere, right? A third of working adults in Canada are caregivers in some way, shape, or form. And if you look at the numbers behind that, you look at the numbers and you total the average number of hours that that third of working adults do in some way for family members or loved ones, that's something like 20 hours a week on average. Something like 6 billion hours of unpaid and unrecognized work per year in total. So that's a huge economic cost, but also a huge health cost to the people doing the unpaid, unrecognized labor. And as a family doc, I see that in so many people that I care for in my practice. And then on the other side, I've seen involving families, caregivers in care for their loved ones only lead to good things. It only leads to good things. It leads to better, more careful, safer care, kinder care. And I split this up into 2 lenses, because there's kind of a good and where we really need to improve. So the good is that on one hand, there have been so many situations that I've seen where people's families or caregivers have shared information or advocated in a really healthy way, or just been present in a way that's actually been healing for their loved ones, and on and on. And that needs to be recognized and actually cherished and held sacred by the health system and by us as health professionals. as well, because we're the health system for people. And then on the other hand, there's this tragic normalization in the health system of family caregivers, of that 20 hours per week of unpaid labor, of being that, you know, sole source of information and safety and advocacy for a lot of people. And people are filling those roles in a very lonely way with very little support from the health system itself. And I think as a health system and as health professionals and people involved in healthcare, we've come to take that for granted. We've come to take it for granted, all while not fully appreciating the benefits that this caregiving has for people that are, you know, navigating the health system or doing their best to navigate the health system. And then also the toll that it takes on the people doing that care, so the caregivers and the families themselves. So, you know, there's a good part of this and a part where I think we do need to recognize the value of caregivers, but then also how do we support that value, and how do we not just rely on families and caregivers to do what's really a health system responsibility for their loved ones.
So Dominik, tell me though, how did we get here then? So you're talking about how valuable caregivers are and how essential they are. We've heard from Terrence and Maggie how you know, they didn't generally feel included. We've seen over COVID, we've seen caregiver restrictions, which has been so devastating for so many families. So how did we get here, and why aren't caregivers recognized as valuable?
Yeah, I think there are several different things at play. One of them is a culture issue. It's definitely a culture issue in that we have this world where formal expertise is highly valued, right? So if you have an MD or you're a clinician or you're involved in healthcare and you have that formal training and education, okay, you know, you have a spot there, you have a contribution to make. But then on the other hand, we don't necessarily value lived experience, right? And this understanding that comes from being a caregiver or a family member or loved one of the person actually experiencing care and the value of that understanding when we should, right? And I think back to what Maggie shared earlier, where, you know, despite, and that resonated with me, despite my training and you know, the years of study and practice and everything like that, I didn't fully understand how tough it is to go through healthcare until I had to walk through it with family members and with loved ones. And I think that's really the culture shift that needs to happen. It's valuing that lived experience and valuing that it's not all about the formal expertise, but also lived experience is an expertise that needs to be at, you know, planning and how we shape the health system and what kind of solutions we have for this as well. I'd love to hear from Terrence and Maggie on this question as well.
Yeah, Maggie.
I'm gonna jump in. So thank you for that, Dominik. That really sits well with me. It means a lot. You know, I think one of the things that we have to do as we talk about culture is recognize the existing power imbalance that is there. Yeah. You know, it exists, it's there. And as a caregiver, I lack power in the current system. And I worry about not rocking the boat. I worry about negatively impacting the care of my sister. So I've had to seek out ways to be involved rather than being invited to participate, to be part of the team. So I think we need to sort of address that part of the culture. I think many of us worry about the impact of our involvement on the delivery of care. And I also worry about what will happen if I get sick. So personally, I struggle with, you know, being vulnerable enough to ask for help and being professional while being a daughter and sister, being assertive, but in the right way, having my voice heard while not raising it too loudly, all of those things that power imbalance creates. So I think, you know, when we talk about changing the system, we really need to think about changing that underlying culture to begin with.
Terrence, what are your thoughts?
I think, like, now from my experience of having cared and advocated for my brother, and then also done the same for our mom, who died of stage 4 lung cancer last year. And I was also a power of attorney for an elderly family friend with dementia. What I noticed, and what Maggie said earlier, it's like, we are the like single source of information to all the service providers. Mm-hmm. So I don't know in what way, because they all turn to us for this information. So we are the most reliable source, being at the front line. But then now it's kind of like what Dominik said, because we don't have like a certification or anything. We are not recognized in that professional manner, but then we are still turned to for this like single source of like the truth of the loved one that we're like advocating and caring for. So that is a gap, and I guess that needs some kind of like transformation or mindset shift in the healthcare system to then like make us formally, as a family caregiver, to be formally part of the care team. Whether it's like, there could be like financial compensation, because it is, like Dominik said, like on average 20 hours per week that we're advocating or providing physical hands-on care support. So yeah, I think it does take some mindset shift and some like, I guess like process changes too within the healthcare system in how we engage caregivers.
Lisa, I wonder, so I just want to emphasize that what Terrence shared around that single source of information. And that's so important, because actually the times that I've seen caregivers and families involved very well, and the information and understanding of a person's values and everything like that they've shared, it's not just been a nice to have. These are pieces of information that have actually been life and death. They've actually been, this is actually a matter of life and death. And the information that's shared can actually be life-saving, or if it's not valued and not understood, can actually be a source of significant medical error and harm, right? So this is actually a conversation that's not just a nice to have conversation, but a need to have conversation, how we incorporate that and value caregivers and that sole source of information. How do we support people and doing that to whatever extent they can, because not everyone actually can do that 20 hours of care and then keep on going for weeks or months or years and years and years indefinitely.
Mm-hmm. So Dominik, that brings me to my next question. Actually, I have two questions for you along the same lines. Is first of all, as a caregiver, how do we have those conversations? What would you recommend? And also, how because what you all are talking about is systemic change, and so how? And I know Maggie and Terrence will have some things to say about this, but you're talking about the larger picture as well. How do we change? Not every healthcare provider feels like you do about the role of caregivers. How do we get there?
Yeah, I'd love to say that it's so my first response to this question is that it's actually not, it shouldn't be on the caregiver or the family member to have to learn how to navigate healthcare and how to have difficult conversations with their health professional or hospital or health system or whatever else. That shouldn't be a responsibility that we place on people who are just trying to do their best in walking through healthcare with their loved ones. And it's totally inappropriate that we ask people to do that as they walk through healthcare. That's one. And we need to design healthcare in a way that's not a prerequisite. So it's not like you have to go through clinical training or go through some extra kind of training to actually navigate healthcare successfully and advocate and go through this power dynamic and everything like that. On the other hand, I recognize that power dynamic exists, and that perfect utopia of healthcare is still far off, right? Even though there are pockets where maybe we're doing it better in some places. And I would say there are groups that can help with having those conversations, that can help with navigating healthcare and navigating that caregiver experience. And some of the places that have really come up really beautifully and thoughtfully in the last few years, especially, have been, for example, the Ontario Caregiver Organization's Ontario Caregiver Hotline, right? So this is a hotline available in many different languages that supports caregivers through different parts of their health journey and connect people to resources. Another one is just Canada 211, right? Again, over 150 languages. They have been a remarkable source of connecting people to local supports that are available for caregivers, groups, other types of supports that can help people as they navigate healthcare. And on, right? Peer groups, all of these things are available for people that we can tap into. But I think the challenge is as well, like Terrence said, not all of us identify as caregivers right away. So not all of us think that, okay, you know, our experience is hard enough to justify some of these resources, when in reality it is, right? Healthcare is hard to navigate. I think we just need to say that and support people and how they move through it and how they support their loved ones in moving through healthcare.
So I want to hear from Maggie and Terrence, in your experiences. Why aren't caregivers valued, and how can we get them a seat at the table?
So I'm happy to start with that. I think there's a fundamental issue that's a lack of knowledge about the role of caregivers, both for caregivers themselves, as well as for those that are working in the health system. Caregiving is not like a job with specific hours or a job description. And so you don't have that as a guide. In fact, more often than not, I'd say, especially during times of crisis or when a disease is being exacerbated, it's really all-consuming. It's a 24/7 role. I know I'm not alone in saying that I had to change my career because of the responsibility of caregiving. Moved to a part-time career as opposed to a full-time role in healthcare. There's almost no training for being a caregiver. We need to also boost the education and knowledge of healthcare providers. So I think, as Dominik said, we're starting to see more resources being developed and more organizations like the Ontario Caregiver Organization that are working really hard to address the issues. We still have a way to go, but I think that, you know, we are heading in the right direction. The other thing I'd say is that we have to recognize that for caregivers, advocacy and involvement means different things for different people, and that's okay. We all have a different view and different capacity when it comes to advocacy. For some, it might mean lobbying government, it might mean fundraising, this might mean finding a way to advocate for the person you're caring for so they can get through the experience they're having in a hospital, for example. I sometimes think about Sue Robbins, who summed up advocacy really well in her book, where she says there's no one right way to advocate. The most important thing is to be kind and forgiving of yourself as you find your own way. So, I would encourage caregivers, as I said, I have experienced guilt and I've experienced this feeling of being the weakest link in the chain when it comes to my sister's care, is to give yourself some forgiveness and some kindness. We talk about self-care, and I know we might touch on that, but I think being kind to yourself and recognizing that we all aren't going to be out there banging a drum, and that's okay.
I'm wondering can you tell me, have you had an experience where you've had a win in terms of being recognized as valuable? Can you tell us a little bit about that?
Sure. So I will tell you, so when my sister was in the ICU after her surgery and unable to communicate and all of those things, it made me think of this story when Dominik was talking about the fact that caregivers can be a life-saving part of care. So I was trying very hard to for lack of a better word, I'll say push myself into the team because I wasn't recognized as part of it. But during her ICU stay, she developed a terrible amount of vomiting and nausea, which after a surgery like hers was problematic. She had a G-tube in. It should have looked after it, but I know her well enough to know that she has a particularly hypersensitive stomach. So I made an observation to one of the nurses saying, you know, I really think that if someone moved this G tube a little bit, I think it's irritating her. And I think it would help if someone would take an x-ray and then move it. The nurse listened to me. They did take an x-ray. The doctor said, no, that won't work. It's fine on the x-ray. The nurse then advocated that we go ahead and get the, you know, obviously with the doctor, but that we try it. And it worked. It worked beautifully. And her nausea and vomiting stopped so that she could start recovering. From that time on, I offered to be part of their morning rounds with her, and it was accepted. And it made a tremendous difference. It made a difference to me, knowing what was going on with her, because there were so many different teams looking after her. It made a difference to her and her care. And I think it made a difference in terms of aha moments for the healthcare team, where rather than being seen as a nuisance, I started to be seen as a helpful part of the team.
Wow, I really like that story. We don't hear enough of those stories. Terrence, I wanted to turn it to you. I want to hear a little bit about why you think caregivers aren't considered an essential part of the care team, but also if you can share a win.
Sure. Yeah, I've had similar stories too, like where when I was the power of attorney for a family friend with dementia, and this family friend had no family and country, it was so easy for her to fall through the cracks of the healthcare system because she wasn't able to advocate for herself as she was going through her like health challenges. So then for me to all of them showed up, I remember showing up to the hospital and they're like, "Who are you?" And I'm like, "Oh, I'm a family friend." But because I had a good sense of like her 360 of like what she's experiencing, they're like, "Okay, you come in and like you tell us." And for about 2 years of her going in and out of the hospital, and as her power of attorney, I was able to like continuously advocate and activate services for her, and recognizing that what she needed was actually to be somewhere safe, that she was going to be taken care of. And then finally 2 years later, being accepted into long-term care. And now she's thriving, having been in there for almost a year now. But at the same time, a lot of the healthcare service providers, because I wasn't officially like family, at first they were kind of like, "Who are you? Like, what are you doing?" But then for me, like I knew that what she needed, and then just had to keep fighting for it. And first getting the power of attorney legally like documented, and then afterwards, like then coordinating all the services and really like talking to everyone involved to get her the care that she needed. So I think part of
I was going to say what a difference that made to her quality of life.
Yes, and it's not a role that kind of like these wins that both Maggie and I shared may not be something that anyone wants to take on, because I know that with our family friend, none of her other friends wanted to take on this role because it's daunting, it's time consuming, it's mentally, emotionally consuming. So not everyone, and just because for anyone watching, like if you don't feel like doing it, and that's okay too. So I think part of the healthcare system too, like another opportunity is like, because all the service providers work in like silos, no one can actually like coordinate this like full picture for the person. And that's why I feel like perhaps because the healthcare system doesn't work hand in hand in that way, that's why we as like caregivers, we're not, there's no like role, because we're just, we're like this informal person that then brings everyone together. But then because we're not, there's no like a association of informal caregivers that we could like that brings all of us together and like trains us and like and teaches us how to be healthcare navigators. And so I think that's probably why we're not valued in the same way that we're actually doing amazing work. And like in my being thrust into the role, I I would say, patting myself on the back, like becoming an amazing healthcare navigator, where family and friends now turn to me for like guidance. But again, kind of like what Dominik said, we don't have formal training of any kind. We just kind of like learned along the way.
Yeah, and I mean, you could argue that you're getting your training, right? You have like this stamp of life experience right there. I really want to talk about self-care, but I wanted to go back to something that you mentioned earlier. Talking about just that you might not want to do this job. Man, caregiving is damn difficult. It's hard, it's sad, it makes you angry, it takes energy. And I know from your story, you you had a story on healthing.ca about the changes you've had to make to your own life. You make choices, right? Where you live, what job you do, where you go to school, if you go to school. These are all things that impact caregivers. And yeah, I think that's really important to say. You don't have to love it. It's really hard to love. It's a hard job to love. And even just pushing aside all of the the physical and energy, all of that stuff, there's also that sense of loss. You're caring for someone who's not well, and that stinks. It stinks on so many levels. And so I really like that you mentioned that it's okay to say it sucks, because yeah, it really does. It really does.
Can I add, Lisa? I think it's a really important point, because not all of us have choices about being a caregiver, and we do the best that we can. But I want to recognize the strength that it takes for people to tell their stories. It's not easy. It's emotional, it's draining, it's hard to do. But to a person, the caregivers that I've talked to who share their story, despite the fact that it breaks their heart anew every time they do it in the hope that it'll help show that it's time for change. They do it in the hope that it can move us from a fragmented system to one that really is inspired by the needs of not just patients, but families and caregivers and communities. And I think it's important to recognize that most of us don't have a single Kleenex-worthy crisis event. We have a kind of a series of a lifetime of small events that pile up and pile onto us and exhaust us and drain us, and make us feel vulnerable. So it's important to acknowledge that, I think, and to, Dominik, to your point, I know if a family doctor just turns to me and says, how are you doing in all of this? Just the posing of that question alone is such a support that many of us don't have.
Actually, I just want to add on to that, where when our mom's palliative care team started supporting her, it was the first time I ever heard a care team ask me what I needed. And it kind of took me aback when I heard the coordinator ask me that. And I was like, oh, I'm not sure what I need, but I know I need help. And then for them to offer me all kinds of services like mental health worker, and do you need more respite care for to ensure that your mom's taken care of so you get a bit of a break. And yeah, that was probably the first time, after so many years of being a caregiver, that was the first time I heard a care team ask me, what is it that I need? And that was kind of mind-blowing for me. And we definitely need more of that too.
I've seen beautiful examples of this in family practice from role models, but then also examples like link workers in the NHS, or systems navigators as well. There's no reason why it needs to be, I think, a physician who asks some of these questions in terms of systems navigation for caregivers. And I think of how much of health is related to kind of the non-medical and the non-biology side of things. And actually, probably that 20 hours of caregiving responsibilities that people have, that takes a toll. It's not just an emotional toll but it's also a physical toll and a health toll on people. And oftentimes, I see people in my practice that come in with their loved ones, but then don't necessarily even have the time or bandwidth, right, to work on their own health and to have their own health visits. So taking those conversations opportunistically, as their family doctor, or even connecting them to someone like a link worker or like someone from the Ontario Caregiver Organization, or these folks like that who can help support that individual's health journey as well. Look at what it means for that person to be healthy, in addition to whoever their family member or caregiver is to stay healthy.
I think the other piece of that, Dominik, Terrence, you alluded to it, is the fact that a lot of what we do as caregivers isn't in the formal health system. Mm-hmm. So, it's social services, it's other parts of the system that aren't necessarily connected. So, having a way to have conversations that connect those dots, I think, is really helpful for all of us. I think a little bit about family practice, and as you said, just how it doesn't have to be a doctor that necessarily opens up the conversation. I think the important piece is that someone other than the caregiver opens up the conversation, right? And gives you that opportunity and shows you that kindness and gives you that space where you can have a conversation about what's going on. And many of us won't do it on our own, but if someone opens the conversation for us and gives us the ability of a platform, we will definitely take advantage of it.
Absolutely.
Hi, sorry guys.
That's okay.
All right. I'm sure you guys have carried on with a wonderful, insightful conversation. I wanted to get into the issue of self-care. Maggie, when we were on a briefing call, all of us, and the topic of self-care came up, and things like you were very quick to respond. Things like yoga, take a walk, meditate. All of this advice that seemed quite pat for caregivers to help them through. And you had some strong opinions about that. So I want to talk a little bit about that. It's something that we hear a lot about from readers, just struggling under the burden of caregiving, and yoga's just not going to cut it in terms of seeking relief. So from Terrence and Maggie, if you guys could tell me a little bit about, first of all, I guess I want to know what works for you. How is it that you stay optimistic? How do you get out of bed every morning? And how do you go back to this very difficult task of caregiving every day? What kinds of advice can you offer for viewers who are struggling with their tasks of caregiving? And then also I want to turn it over to Dominik as well for some ideas on, how do you get through every day?
So you're right. So the self-care is a little bit of a trigger for me, to be very honest, as you saw in our call the other day. I think we have to be really careful when we're talking about self-care and resilience. So, resilience isn't about yoga, and it's not a cup of tea. It's not getting out of the house for a few hours. These things are self-care, and they're necessary. So don't get me wrong. The concept of self-care places the sole responsibility on caregivers. And some days, to be very honest, I barely get through the day, let alone look after myself. So caregivers are told to focus on self-care. And we're often told it's the best weapon against burnout. I don't think that's true. The best weapon against burnout is a transformed system that values us and that doesn't treat us and our work as disposable. So, when I think of my time as a caregiver, I actually dream about never being called resilient again. I'm worn out by the pursuit of strength and resilience, and I crave kindness. I crave relationship. I crave empathy. I don't want to be patted on the back and to be commended for holding up, for being strong, for doing my part. And I think we sometimes conflate resilience with coping skills. So frankly, being a caregiver to someone homebound in a system that has increasingly constrained resources, the issue is not my coping skills. The issue is that there's not enough of me to go around, and the system doesn't have the capacity to meet our needs fully. You know, I think our society and our health system needs more caregivers and more helpers, but we need more support for those who are caregivers so they can carry the responsibility. You know, I sometimes think about, I promise I'm gonna stop, but I am passionate about this. I sometimes think about boundaries, and I think it's essential that as a caregiver, you develop some expertise in setting boundaries. And boundaries are the flip side of asking for help. But if you can do both, if you can learn to say no, and I need help, I think you've found the secret sauce for surviving or maybe even thriving in this experience. We've talked about caregiving as a burden. It's also a blessing. And I know I sound naive in saying this at times, but I mean it. The things that I have learned in caregiving, the things that I have learned about empathy and about what matters in life and about relationship, I would never have learned otherwise. So it is not all to be dealt with. There are very positive things, but I think finding that balance is probably where the secret lies. I'm going to apologize for my dog too, but otherwise you get a barking dog if he's not sitting on my lap.
So I was dying to say, who is this person who keeps or this dog that keeps looking at you with such loving eyes? What's his name?
His name's Mosey.
Oh, hi, Mosey. Oh, so sweet. All right, now I'm very distracted. However, I'm going to go to Terrence on this, but Maggie, I wanted to address your comment about caregiving, burden versus blessing. And I have been there as well. And as you're absolutely right. And it's an important thing to note that as difficult as it is and emotional and draining, that there is, I've learned it changes you as a person, and I also have learned so much about empathy and just even humanity, right? And also, I mean, it's the reason why we're here. Like, these things have taught us identify gaps, right? We're talking about this because we don't want anyone else to go through what we've been through, and so it's extremely beneficial. There's a piece of the blessing there. Terrence, I wanted to talk to you about, turn it over to you in terms of this, to self-care. What do you do? I mean, you especially long decades of caregiving for you, and add your mom to that too, and your family member. I mean, that's a lot. How do you stay optimistic? What do you think of this concept of self-care? And are you with Maggie, where Maggie says, I'm tired of people talking to me about being resilient? You must, do you share that feeling?
Well, what Maggie said, especially around the art of practicing our boundaries and then practicing how to ask for help, that really resonates with me. And after almost 3 decades of being a caregiver, I think I've only learned that in the last 2 years, really. So it took that long to be able to say, oh yeah, I know my boundaries and I know how to ask for help now. Wow. And incredible things have happened for both our mom and my brother now, having me learning how to do both of those things. So that, I would say, if anything, by doing that, it actually helps me feel much better in terms of my own well-being. Mm-hmm. I would say the other part around ensuring that I am well through caring for myself is mm-hmm. being open, and this may not be something that's everyone's comfortable with, is actually getting professional therapy support.
Right.
So last year is when I first started getting psychotherapy from psychotherapists that specialize in working with caregivers, and also grief counselors, because when our mom got her diagnosis, I restarted my process of grieving. And so to have a counselor that focuses on grief and caregiving was extremely valuable to me. So for years and decades, I've never turned to professional help. But then now that I started it last year, I'm like, now I can't live without it. It's been super valuable for me to have one, an outlet, and then also someone that one is not judgmental of me, is curious, helps me explore certain things that I'm like experiencing in that moment. And just to have someone that I could like talk to and like work things through together has been tremendously valuable. And to me, that is someone that I will ensure that that's part of my own care and well-being team for the rest of my life. So I found that is like one of the biggest value add for me. And to have had like service providers offer that to me as a caregiver in the last 2 years, that to me was, wow, like I am now taking care of myself because someone else is caring for me. Right. So I'd say therapy has been a big one. And then the other ones beyond like, the going outside for a walk, I'd say more like support services, like for our loved ones. I would say that would help me in my own well-being, because if I am cooking, cleaning, doing all the daily stuff, plus like being at appointments and like advocating and all that, like somehow like even taking some of these services away from me, or these like roles away from me, would help alleviate my own well-being, to prevent me from going to burnout. And I know that for example, in Ontario, the Ontario health teams or the LHINs, a lot of the day-to-day operation stuff that I do for our family as a household, they don't have services that could actually support us in that way. So then in the end, it's like, oh, it is up to me again to like manage all those things. So I'd say not self-care, but for a caregiver's well-being, to have a wider range of like services available to us, that then could alleviate the pressures and stress of the day-to-day caregiving role. I think, and another thing that I found valuable during our mom's care was also then involving like family and friends, because they also want to be involved, but then it also requires me to coordinate all those things because they want to bring food, they want to spend time. And I think it's valuable because it is also part of the sort of like the care circle for the person at the center. But at the same time, like as the caregiver, we are also coordinating that too. But that also helps, but it does help. Yeah.
So Dominik, why don't you weigh in on self-care? I'd like to, we've been answering readers' questions actually through this discussion, which is really great. But I wanted to get into a couple of reader questions. So, but Dominik, please weigh in on your perspective. I mean, what do you see in terms of how, caregivers should take care of themselves?
Thanks, Lisa. I think I'm like Maggie and Terrence in that I think we need to throw out that self-care terminology altogether, right? And I think we replace it with system care, right? Really, the responsibility is on the system to create a health system that's actually friendly to navigate, where people aren't exposed to trauma just by trying to get through somehow care for their loved one. And an example of how to do this is what we've seen in social prescribing, right? So social prescribing is, what I'd call a movement of addressing social needs when they come up in a medical context. So you think of things like food security or housing or income, the caregiver's own, work situation, like Maggie shared earlier, all the way to things like racism and colonialism and their impact on health. And, I think, how on earth is it possible to even think that self-care alone could help people when they're spending 20 hours of unpaid labor per week supporting their loved one through the health system, not to mention those many intersectionalities that come up with the other social determinants of health that impact, how they experience healthcare for themselves and for their loved one as well. So I think that's really where we need to think of not just self-care, but system care. And then social prescribing is one example of how to do that. So I'll give you an example very quickly. I had a person in my practice that I was working with for many years, and actually it came up that their parent, older adult, had a new diagnosis, and they became a caregiver. They were thrust into this responsibility almost overnight, a few months prior, and it was actually having a huge impact on their health in terms of mental health, but also things like diabetes, many other things that we were working through. And actually, the most valuable prescription that I could have given them over any medication was actually looking at some of the social supports for them and then for their dad as well. So we actually, with their permission, we actually called 211 in the office. We had a conversation with them as well, but then also because 211 has over 150 languages, there was someone from 211 that was able to call their dad and see what their dad wanted, what mattered to them, what were the pebbles in their shoes day to day during this journey. And because of that, they were able to set up their dad with several things. So nutritious food, with an older adult access center nearby with programming, and that could actually do some day trips with the dad that they actually really enjoyed. And a few other things that were actually very meaningful for both. And then that was actually good for the son as well in terms of their own health. So from this one call, from this one social prescription, we actually got a lot of value for both people, and in a way that made a difference to both of their health, right? And it wasn't a classic medical type of issue that we were dealing with, or a medication or a diagnosis, but it was the 80% of health that's beyond that pure biology that we need to think of in healthcare. So that's what I see as the future of where we take this. It's really addressing those social needs, both for people going through care, but also for their families, caregivers, and so on.
So Dominik, I'm going to keep you for a second. In terms of, in the theme of support, we've had a few questions, more than a few questions, about technology and how we can use apps, or, so what are some, do you have any suggestions for technology and how caregivers can use technology for both support and also maybe to do the job of caregiving, maybe facilitate the ease of caregiving?
Yeah, and I think there are pockets of this that are in the right direction. But the secret to this is taking what's working well and those pockets that are working well and make sure that it's happening everywhere. And I'm not just talking about, a portal here, a portal there, so people end up with 20 different passwords and 20 different portals that are hard to use, but some kind of a way that technology gets to the root of the problems that we're identifying here and the future that we're imagining here together. So I think of what Maggie shared earlier, in that power dynamic as a big barrier to caregivers being valued and involved in people's care. So that's where actually sharing information can make a difference and leveling the playing field, right? And where technology could make a difference. And I think it's less about the fancy technologies and more about, what values do we want coming into play, and what are some of these simple things that we can actually do right now to make that happen. But I'd love to hear from Maggie and Terrence on this question as well, in terms of what they've seen.
In terms of technology or apps that maybe you've benefited from?
So I'm going to be brutally honest. So far, technology has not been my friend in terms of my caregiving experience. And that's not to say that it doesn't have the potential to be, but to date, it has not been. And I'm with you, Dominik. I don't think any of it is rocket science. I think the technology that we have access to now could be guided towards helping support caregivers. I'll give you an example. When I talked about my sister, excuse the dog here. When I talked about my sister having 4 different sets of hospitals and providers, plus her primary care, one of the things that was most frustrating to me was that, I mentioned this in our call the other day. I leave the house and my phone immediately tells me that I'm outside of a certain geography, so it's going to turn down my heat or my air conditioning. These 4 hospitals could not coordinate and exchange her radiology films. So I spent a day driving from one to the other, pick them up and coordinate them, being the project manager. bringing them back to her surgeon. And that didn't have to be. The solution is simple. It is not fancy. It's not super sophisticated. But I think leveraging what we have available, we could do a much better job.
What about you, Terrence? What do you think?
Yeah, I've also not had any like experience of using tech by different service providers. And in the end, the way that, because as a caregiver, I am the single source of information. So I just keep my own log as I was providing, like supporting my brother or mom in a Google Doc. And then I would just share it with the different service providers because they were all separated in how they collect information. So at this moment, I would say there's still a lot of opportunity to utilize technology in a valuable way for everyone as part of the circle of care. But right now, there hasn't been any like practical systems in place that makes it easy for all like everyone on the care team to like be part of a technology platform in any way. So yeah, there's still great opportunity here.
And Lisa, I'll share just very quickly. If you think about health records, health records, if you think about the care team, and that you think about the person who's receiving care and then their family members and caregivers as part of that care team, every single member of the care team can contribute to a health record except the people at the very center of it right now. And why is that the case? Why wouldn't, like Terrence said, people who are most familiar with that truth, that's a person's experience through health and their life journey and everything like that, be able to collaborate with the rest of the care team just in terms of that medical information and contribute to that information. That's actually a matter of life and death for a lot of health situations. So I think that's really where the future is in terms of nothing fancy, but really changing how we think of health information and with people and their families and caregivers, rather than only for us as doctors or only for hospitals.
Exactly. Calling all startups, technology companies. We have a need. All right. Well, so just like that, our hour has pretty much flown by. We have 3 more minutes, and in that, I would like to just go around the room and get your final thoughts and what you'd like to leave viewers with. Maggie, I was hoping to get Mosey's view on things, but it appears that he's gone. So
he's left, so he won't be telling us.
He's done. All right. So Terrence, I'm going to start with you. What are the messages or message that you'd like to leave with viewers who joined us today?
Well, I'd say for the family caregivers out there, you're doing an amazing job. It may not feel that way on a day-to-day basis. So just for those that are wanting to continue to like really part of the care team, I would say at this moment, we just have to keep fighting for it, to kind of like stick ourselves into the care team and advocate for our loved ones in that way. So keep going. And then for any like healthcare leaders that are on this call, I'd say bring us on board. Like, yeah, like have a caregiver advisory team or things like that. Like give us a voice in how you create your systems and processes. So yeah, those are the 2 things that I would say.
Very good. That's an excellent point. Give us a voice. Maggie.
So I'd say when I reflect on our experience as a family, I draw a distinction between treatment and care. And I'd say that once my sister was diagnosed, she received world-class treatment, for which we're eternally grateful. But we have not, as a family, in fact, received world-class care. And my hope is that this movement to make the care and healthcare a verb, not a noun and not a place, not a system, it's not a fad, and it's not going away. We're starting a movement in this country that recognizes the value of caregivers and the value of a relationship in medicine that I don't think there's any going back from. And I am encouraged by that.
Amazing. And Dominik, you get the final word.
I'll just say, I'll pick up on what Maggie shared. The relationships are so valuable. We know that people with a family doctor, they're healthier, they have more preventive care, they actually live longer. So I would say if you're navigating health for a family member or a loved one, if you're a caregiver, find a family doctor. That's for yourself, right? Not just for your family member. And then there are these amazing supports in the last few years that have really come up, like the Ontario Caregiver Helpline, like Canada 211, again, in over 150 languages. And then it's going to be a matter of shifting culture, making sure that we're involving caregivers and families in care. And then also making sure that we look at what other steps we need to take, like technology, to support that involvement, to support those culture shifts that we want.
Thank you. Well, thank you everyone for joining me today to talk about this very important issue. I'm hoping that if we gather again in 5 years to talk about this, that maybe we won't have anything to talk about, because it'll all be amazing for caregivers. So thank you again, and thanks to all our viewers for joining us today. The recording will be available on healthing.ca in probably the next day or so. And feel free to reach out if you have some questions that maybe weren't addressed in this discussion. I'm happy to address them. Otherwise, I guess we're going to sign off. Thank you again, everybody. I really appreciate it.